Hello, my name is Meagan DeLuca. My partner is John Eakin, and we will be teaching a modified version of the Tackmann Activity 17 Tobacco Death List. The objectives of this lesson are to recognize and identify some of the dangerous chemicals found in smokeless tobacco products, acknowledge the health risks each chemical poses to the body, and understand the harmful effects tobacco products have on your overall health. The first dangerous chemical is formaldehyde, and it is a carcinogen that is typically used to produce fertilizer, paper, plywood, and is used as a common preservative. High oral doses have been shown to cause stomach damage and cancer of the nose and throat. The next chemical is propylene glycol, which is a synthetic liquid that absorbs water and is used as a solvent in the paint and plastic industries. It is also the poisonous ingredient used in the antifreeze for your vehicle. Another chemical in tobacco is arsenic, which has been recognized as a human and rat poison since ancient times. It is found in smokeless tobacco and shown to have many health effects dependent on how it is ingested. Orally, it is shown to cause darkened skin and corns or warts on the palms of hands and soles of feet. It changes the blood vessels of the skin and can cause skin cancer. Swallowing arsenic increases risk of cancer in the liver, bladder, and lungs. The next chemical is toluene, which is used in the embalming process. It is also used in making paints, nail polish, adhesives, and paint thinners. The most serious health concern is that toluene may affect your nervous and immune system. It may also affect your brain, liver, lungs, and kidneys. These harmful dangers of toluene are dependent on the amount you take in and how long you are exposed. The next chemical is plutonium-20, which is notoriously used to make nuclear weapons. It is a radioactive metal that causes cancer of the lungs, bones, and liver. It also affects the body's ability to resist diseases. The next chemical is cadmium, which is a metal used in oil paints. It severely irritates the stomach, causing vomiting, diarrhea, and sometimes death. Long-term exposure can cause bones to become brittle and to build up in the kidneys, causing major damage. And the final chemical found in smokeless tobacco is benzene. It is widely used to make plastics, resins, rubber lubricants, and pesticides. Brief exposure to high levels may result in death, while long periods of exposure may cause problems in the blood and tissues in the bone marrow. This can cause cancer of the blood-forming organs like acute myeloid leukemia. Benzene is also harmful to the reproductive organs.
Harmful effects to the body. Many harmful effects are associated with smokeless tobacco, and there are absolutely no health benefits. It has been proven to lead to a nicotine addiction, cause cancer of the mouth, esophagus, and pancreas. It can cause gum disease, tooth decay, and white or gray patches inside the mouth known as leukoplakia, which puts users at a high risk for oral cancer. It also increases risk for death from heart disease and stroke. We have 3 questions for the assessment portion. The first question is, what percentage of the adult 18 or older population uses smokeless tobacco? 3.4%, or 3 in every 100 people. The next question is, why is smokeless tobacco addictive? All tobacco products contain nicotine, the chemical that makes the products addictive. What cancers are caused by or associated with smokeless tobacco use? Smokeless tobacco users increase their risk for cancer of the oral cavity. Oral cancer can include cancer of the lip, tongue, cheeks, gums, and the floor and roof of their mouth. And these are references.